Muscle Doctor, hi, it's Liam here, and today we're going to take a look at the anatomy of the knee joint. So we find the knee joint at its deepest layer. We're going to look at the bones that make up the knee joint or joints. We'll start with the femur, the thigh bone, which articulates with the tibia. This forms the knee joint proper, otherwise known as the synovial joint of the tibiofemoral joint. Where these two bones articulate, we've got cartilage that allows them to glide and to move together friction-free. Wear and tear of this cartilage can lead to osteoarthritis. But we're not done there. We've got the flexion and extension, also tibial rotation at the tibiofemoral joint, but we've got another bone there called the patella. So the patella is a sesamoid bone, which just means it floats within a sea of connective tissue. We've got cartilage on the back of the patella as well. Wear and tear in this cartilage or the cartilage on the femoral condyles can give us patellofemoral joint pain or osteoarthritis of the patellofemoral joint. Just underneath that, we've got where the tibia meets the fibula. We call that the tibiofibular joint or the proximal tibiofibular joint. We're going to disregard the fibula for now, as it's not really a bone of the knee joint itself. So the knee joint, as you can see, it's inherently unstable. So we've got the biggest collection of ligaments that you'll find in the human body supporting the knee. So if we add those on, we can see the lateral collateral ligament just around the side, on the lateral side. We've got the medial collateral ligament as well. And then we've got some more ligaments as well. And we'll need to see inside the knee for those, which are the anterior cruciate ligament and the posterior cruciate ligament. So called because cruciate meaning cross, the two cross over, and they give us stability of the knee. They connect the femur to the tibia. They also prevent anterior translation through the ACL, anterior cruciate ligament, and posterior translation of the tibia on the femur via the PCL, posterior cruciate ligament. We've also got another layer of connective tissue in there called meniscus. So meniscus is a C-shaped piece of cartilage that deepens the knee socket. So this can also be commonly injured, and if it is, we can end up with a meniscal tear, which can actually represent or present in clinic similarly to osteoarthritis. So be aware of that. Onset of the injury, age of the patient can all be clues as to which one it might be, if you think either of those might be the cause. So let's start to add some muscles to the knee joint. We're going to begin action by action looking at knee extension. So knee extension is where we straighten the leg out, and we've got 4 muscles that work to achieve that. We call these the quadriceps group. The quadriceps group, as it would be indicated by the name, consists of 4 muscles. 3 of those are the vastus group. We've got vastus medialis on the inside or medial aspect of the leg. On the outside, we've got vastus lateralis. And underneath, the bigger of the 4, we've got vastus intermedius. So these 3 only cross the knee joint. So they only act on the knee, providing knee extension. The 4th muscle of the quadriceps group is rectus femoris. So the difference here is that this is a biaxial muscle, which means that it crosses 2 joints. Also crosses the hip. It's out the front, so it's going to flex the hip. You'll see that with vastus lateralis sits directly underneath the iliotibial tract, the IT band. So its entire purpose is to stabilize the lateral side of the knee. And you may have heard that the IT band, your IT band might be tight, or someone else's IT band might be tight. It's supposed to be tight. We've got muscles above it that govern its levels of tightness, but we'll get into that when we discuss the hip. So that comes down and inserts into the tibia, just around there. Quadriceps, as you'll see, they share an insertion point, all 4 of them, into the quadriceps tendon, over the patella, into the patella tendon, or patella ligament as some people know it, and into the tibial tuberosity. So this is the top of the tibia, just there. So we've got 4 knee extensors. When we look at the back, we'll see the knee flexors. We've actually got 8 of those. Similar to plantar flexion, everything at the back of the body can be slightly stronger in order to propel us forward in running. So we'll begin with the first 3 flexors of the knee. The most obvious one's the hamstrings group. Hamstrings are divided into 3 different muscles. We've got biceps femoris, biceps meaning 2 heads. That'll give you a clue as to how many heads this muscle's got. And it's from the femur. This muscle inserts down onto the fibula. Interestingly, you'll see with the hamstrings group, biceps femoris makes up 1/3 of the mass, and it's the only muscle on the lateral side. It inserts into the fibula, and we can see a theme occur in there because this is about 1/3 of the bony mass of the lower leg, and it's the only bone that the hamstrings insert onto via biceps femoris. As we have the layers back on, we've got the two medial heads, which are semitendinosus and semimembranosus. These two insert onto the tibia. So these muscles cross the knee. They also cross the hip. They're on the back of the body, so they're going to extend the hip and flex the knee. So semitendinosus is worth talking about the pes anserine. So pes anserine is Latin for goosefoot, and we call it the pes anserine or goosefoot because geese have 3 toes, and here we have 3 big muscles coming into one common tendon, which is the pes anserine. We've got sartorius, we've got gracilis, and we've got semitendinosus. And we call those the Sargent group as a helpful way of memorizing the muscles Sargent, SGT, sartorius, gracilis, and tendinosus of semitendinosus. These 3 muscles all come from different bones of the pelvis, providing us with some medial support of the knee. Let's have a look at gracilis. Gracilis is an adductor of the hip, but it does also cross the knee, so it acts on it, and this muscle flexes the knee. Sartorius is the same thing. This muscle also flexes the knee. So these 3 together work to give us a medial stability and general stability of the knee. Let's get deeper into those layers then, and underneath we can see the popliteus. Popliteus, the name of this part of the knee, actually gets its name from that. We call it the popliteal fossa, or the popliteal space. We've got veins and arteries and nerves in there, so it's always advised that we don't go too deep into that area. Popliteus is in there as a weak flexor of the knee. It also gives us some support and stabilization of the knee and serves a small role in unlocking an extended knee. We've also got the plantaris in there as well. It flexes the knee. It's more thought of as a plantar flexor of the ankle, but it is in there and it does cross the knee, so it does act on that joint. I mentioned earlier on medial tibial rotation and lateral tibial rotation as well. A general rule of thumb for that, although it's not a concrete way of thinking about it, is that the muscles that cross the knee on the lateral side at the rear are the lateral tibial rotators, and the muscles that cross the knee on the medial side are going to be the medial rotators of the knee. Other things to think about just behind the patella, we've got a fat pad, and we've got a few fat pads in there as well. Fat pads are prone to irritation from impact injuries, so just keep that in mind. We've got lots of bursa in there as well. So bursa, bursae, however you say it, are fluid-filled sacs. And the more inflamed they are, the more fluid they'll have in them. And we can suffer from issues such as bursitis when it comes to the patella and around the knee in general. That's been a brief overview of knee anatomy. I hope it's been helpful to you. If it has, please like and subscribe. You can comment, engage. It helps the channel, helps me produce these videos that hopefully help you as a therapist. Bye for now.